The establishment of some CHIPS compounds in the 66 coastal districts of the Western region by the Jubilee partners has contributed in saving the lives of people in very remote parts of the region. Now, under the program, well-trained community health assistants and volunteers have been deployed to the communities to provide basic health care support to the people in those communities. Kukosu Pepra has more in this report.
Access to healthcare in the hardest to reach areas in the Western region has been remarkably improved, as more than 500 communities have now functioning CHIPS centers, which has brought timely but basic health services to the residents. Through home visits and periodic center visits, communities are served and educated on the basic health issues, sanitation, and supported to adopt healthy living practices which have saved a lot of lives in the remote communities.
Because of the CHIPS compound, you have been visiting them, educating them the need for them to go to a clinic when they are pregnant, then to take their drugs. We give them a lot of education, and because of that, the lives of the people have been changed. And now when somebody is pregnant, that person gets to know that, no, it is time I have to go to a clinic to see for medical care.
Through the support of the Jubilee partners and Japaigo, community health officers and community health volunteers have been trained to provide life-saving services in the impoverished communities where the nearest health facility is sometimes several kilometers away. Kofi Blay has been working as a community health officer at Nyamebetre for the past 4 years.
Because of the home visits, those who have not been going for weighing and other things, you go, you find them. Those who are due for vitamin A, we give them. And then those who are not going to, when the time is due, we call them or you visit them in their house. Then you provide the necessary vaccine that they need. And this has helped so much that the people are so happy with the work that you are doing. Besides that, when people are sick, at first they have to travel for very long distance. But now somebody can even pick the phone and then call me to come to the house to take care of the person. And the people are so proud of such activities.
Through the CHIPS program, outpatient attendance in the communities have increased tremendously. Again, more families have accepted family planning concepts, with more children getting fully vaccinated against the childhood killer diseases. Dr. Apia Dentra is the Director General of the Ghana Health Services.
But basically, you bring in relief to the people in the remote areas. Somebody comes to them who are staying with them, teaches them how to prevent disease. There are certain that disease people do not know how it's caused, but somebody is with you and teaching you. The person also links you up to the next level of care. And the person has also been taught how to manage the conditions. And I see that is very good. We are aiming at getting all the electoral areas, 6,500 electoral areas covered. Now we've covered the 4,000. And we are expecting that if we cover 6,000, then the mortality of mothers and children will drop drastically.
Community folks within the 6 coastal districts of the Western region have fully accepted the collaborative work of the Star CHIPS project, with the chiefs and elders in these communities providing support for workers in the CHIPS compounds to function well.
Yeah, Santa no eme hospital bia. Itini abrewo hospital apomden. It's a kama kuma mamiam dimsika 2,500, which is 250 million. Now I'm sit down kronum, and I'm a DBA chip company. I'm salary 50 million. I'm salary cotton no me dibegu kenekumu. Na fedia miya na Star CHIPS for ni jipego phone. Ombo soma omubi hospital na mami asisia mafam found.
Japaigo and the Jubilee partners believe every life which has been saved gives meaning to their investments as partners.
My name is Karen Caldwell. I'm the country director for Japaigo. Because Japaigo has worked in Ghana for more than 20 years now, working to improve the lives and health of women and children in the country, for us this was a natural partnership, because really at the community is where you're going to help save the lives of women and children. That's where the impact is. And so our contribution was in the form of training health workers, training community health management committees, working with management teams at the district and the regional level, providing equipment to CHIPS compounds, and making sure that all of the necessary elements to make CHIPS function are in place.
Without the work of the funders and the hard-working community health workers, several thousands of people would have died within the 5 years in communities like Nyamibetre, Akwadai, and Angunakrum here in the Western region. Kwaku Owusu Pepra, Joy News, Takrade.
Right, so we're still staying with health issues this afternoon, and doctors at the Confederation Teaching Hospital are reporting an increased number of babies born with no visible anal opening. Quite a difficult one for children. At least 3 babies undergo surgery to correct the abnormality at the facility every month. Head of the pediatrics unit, Dr. Michael Amua, says the alarming situation calls for intensive antenatal interventions. Well, Joy News' Kwesi Deba reports, but I must say that viewer discretion is advised on the story.
Medical professionals call it anorectal malformation or imperforate anus. It is a type of birth defect where the lower part of the large intestine is improperly formed. The condition affects boys and girls with similar frequency. When a baby is born with anorectal malformation, it is usually detected early because it is a very obvious defect. Many children have problems controlling bowel function, and most also become constipated. According to the Texas Pediatric Associates, 1 in every 5,000 births has the condition.
In our part of the world, it's even more than the 1 in 5,000 that exists everywhere.
Tamo of Confanoche Teaching Hospital says the condition, which could be life-threatening, can affect other parts of the body.
But sometimes some of the children may have other associated anomalies, right? Maybe they may have a problem with the heart or with the kidney, and that will be what will determine their survival. And so, but we don't see that quite often. So there's a few on rare instances that you may have a child dying because of this condition.
Imperforate anus usually requires immediate surgery to open a passage for passage of stool. In the case of females, stool may be allowed to pass through the genitals until corrective surgery is performed.
When they are born and we realize that they don't have an anus, the first and foremost thing is to make sure that we've diverted their feces. We bring out the intestines outside. That procedure is known as a colostomy. So we create a colostomy for them, so that the feces can come out from the intestines. And then after that, we may have to do some further investigations. Then, when we are satisfied with the investigation, in about 3 or so months, we will create a new anus for them. After creating the anus, we will have to do what is known as dilatation to make sure that the anus that has been created does not close up again. And then when we've done that procedure known as dilatation, when we are satisfied that now the anus is not going to close up, before we go and return or close the colostomy which has been created, that means that we will push the intestines back into the abdominal cavity. It's after that that the child will start passing through the anus that has been created.
Like many diseases, nutritional deficiency and chemical contamination are among the causes.
Key most among them is a folic acid deficiency. If a mother is pregnant and is deficient of folic acid, if the folic acid level in the blood is not up to a certain minimum required level, then the fetus stands the chance of being born with this condition, right? And so that is why when a pregnant woman goes to the antenatal clinic, most of the drugs that they are giving, one of them is folic acid, so that it will boost up the level of folic acid in their blood to prevent some of these conditions. Aside that, exposure to certain agents or chemicals, among them smoking. If a pregnant woman smokes, there's a high probability that the unborn baby will be born with such an anomaly. Likewise, if the woman takes in alcohol whilst pregnant, they may also predispose a child to smoke, to develop anorectal malformation. And then if the woman is exposed to certain environmental hazards like radiations, if a pregnant woman works in, let's say, a radioactive area, let's say the X-ray unit.
Unfortunately, Mothers of these babies come from poor homes. Dr. Amo observes most of them are from the northern Ghana. Minye is from Kwame Danso in the Branhafu region. She first detected the anomaly on little Ethia in the first month of birth. She was referred to the Kofanoche hospital but could not afford the cost of treatment, which averages 5,000 Ghana cedis due to lack of funds. A group of medical students has taken up the initiative to cater for the treatment of these children. Through their intervention, 6 children have successfully undergone treatment. Gift Yoseakoto is coordinator.
I wanted us to do a project that people didn't know about and create awareness on it. Then I spoke to Dr. Michael Amo, the head of the pediatric surgery unit, and he actually confirmed that that's one of the commonest